Let's talk about your chest trauma or your chest injuries. So to understand it, we need to discuss the anatomy of the chest. So we have here your trachea, and there are two divisions, your right bronchus and your left bronchus. And we have here your thoracic cage composed of your 12 ribs. And the function of this is to maintain or stabilize the negative pressure inside. Dapat may negative pressure dyan para mag-inflate or mag-expand si lungs. Okay? And kung makikita mo, merong red and blue lining. Yung red lining dyan is your parietal pleura, and your blue lining is a visceral pleura, which encloses yung visceral organ, which is yung lung. So, yan yung mga nag-enclose ng visceral organ, like for example, your lungs and heart, yan mga visceral pleura. And in between parietal and visceral pleura is a pleural cavity or a pleural space. Pag sinabi mo kasing cavity, meaning nito, it's a space. So, yung inside that space is a pleural fluid, and it is responsible for decreasing the tension pag nag-e-expand yung lungs. So, also, dito, meron tayong tinatawag na mediastinum. It is where your heart resides, and it is aligned to your trachea. So, yan aligned to your trachea. So, there are two types of your chest trauma, your blunt and your penetrating trauma. So, to determine the extent of the affected parts, we need to do diagnostic procedures, which are the basic are chest x-ray and complete blood count. Your chest x-ray will reveal rib fracture, hyperinflation or deflation of the lungs, yung nag-collapse ang lungs. Your complete blood count may reveal hypovolemia. Okay? Mamaya, malalaman nyo dun sa pathophysiology kung paano nagkaroon ng hypovolemia. And to obtain detailed information about the affected part, we need to do, or the doctor may order computed tomography scan or your CT scan. And with your clotting studies, pag decrease kasi ang clotting factor ni patient, it may prolong the bleeding. Kasi doon sa pathophysiology, makikita mo doon, magkakaroon, in severe cases, magkakaroon si client ng massive hemorrhage. So, pag nag-prolong ang bleeding nun, it will lead to your hypovolemia. Okay? And the doctor may order again typing and cross-matching for blood transfusion. So, hypovolemia also decreases electrolytes in the body. So, kailangan mo ng electrolytes determination. Oxygen saturation may reveal hypoxemia. Your ABG analysis will reveal respiratory acidosis. And electrocardiogram, this will determine whether the heart functions well or maaaring nagkaroon na ng dynamic change dun sa heart ni client. So, this is the pathophysiology of your chest trauma. These are the causes: motor vehicle crashes, and gunshot wounds, and stabbings. Yung motor vehicle crashes, those are the most common causes of your blunt chest trauma, lalo na yung sa steering wheel, di ba? Pag nagkaroon kasi ng collision, ganun, or ng vehicular accidents, nagkakaroon ng impact on the steering wheel. Kasi yun yung nasa harap mo pag nagda-drive ka. So, gunshot wounds and stabbings, ito yung mga cause naman ng penetrating trauma. So, with those causes, it will lead to you the injury of the lung parenchyma. Ano ba yung parenchyma na yan? These are the functional units of your lung, which are your alveoli and the blood vessel. Also, magli-lead into the fracture of the ribs and contusion ng mga muscles, okay, respiratory musculature. So because of those injuries, magkakaroon ng changes in intrathoracic pressure relationship. So imbis na negative pressure yung nandoon, magiging positive pressure, leading now to, diba, hindi na makakapag-inflate silang sa pag positive pressure. So, leading now to your ventilation and perfusion mismatch or your VQ defects. Ano ulit yun? One part of the lung will receive oxygen but will not receive blood or vice versa. And because of that, magkakaroon ngayon ng low oxygen in the blood, leading to your inadequate delivery of oxygen to the tissues, termed as your hypoxia. Another, because of the injury of the lung parenchyma, especially yung alveoli, hindi na makakapag-ventilate yung alveoli, magko-collapse ngayon yung lung, leading to VQ defects and then hypoxemia, hypoxia. Also, with the injury of the chest, the rib cage, and also your contusion, chest or lung contusion, maglilid, especially if it is severe, maglilid siya into your excessive bleeding or massive hemorrhage. Pag nagkaroon ng massive hemorrhage in the chest area, magkakaroon ng low blood volume in the body. Leading now to your hypoxemia and hypoxia. So that is the simple pathophysiology of your chest trauma. Before tayo pumunta sa blunt chest trauma, yan, unahin natin yung medical management ng mga chest trauma. First, your oxygen support. Ayun, tingnan mo na lang dun sa pathophysiology, di ba? Meron siyang hypoxemia. So, kailangan niya ng oxygen support. In severe cases, pag hindi na niya kaya yung mga venturi mask, yung mga nasal cannula, mga ganun, the patient may be intubated and will be connected to the mechanical ventilator. Because of the hypovolemia, kailangan mag-reestablish ng fluid. And also dahil nawala na yung negative pressure, i-re-establish natin ngayon ang negative pressure. So, yun, kailangan ma-re-establish yung mga fluid losses and yung negative pressure na nawala. And also, we need to do the draining of the intrapleural fluid accumulation in your blood accumulation. So, ito, ginagamit yung CTT, di ba, na tackle na ni Sir Mark Reyno, yung sa chest tube thoracostomy or thoracentesis. Yan, ginagamit para mag-drain ng mga fluid accumulation. Also, pag may opening into the chest, kailangan mo ng occlusion. So, ano yung kailangan mong occlusive dyan? It should be nonporous. Ibig sabihin, it is impermeable. Hindi nakakapag-pass through ang fluid. So, nonporous occlusive ang gagamitin mo for the open pneumothorax. Yan. And of course, draining or removing of any air or fluid again pag merong pneumothorax and pneumothorax. So, those are the medical management of your chest trauma. Let's go to your blunt chest trauma. Yung blunt chest trauma, it results from sudden compression or positive pressure inflicted into the chest wall. Ito, wala siyang opening, walang penetration ng object into the chest wall. Pero inside, there are some penetrations kasi yung ibang blunt chest trauma is a rib fracture. Yung bone kasi doon maaring mag-penetrate dun sa lungs mismo. So, dito lang, dun sa chest wall, wala kang makikitang opening. So, that is your blunt chest trauma. So, under your blunt chest trauma is your sternal and rib fractures. Is most common in motor vehicle crashes. Yan, sabi ko nga, by your steering wheel. Yung ginagamit mo sa pag-drive, yung manibela. So, that's your steering wheel. Fractures of the lower ribs are associated with injury to the spleen and liver. Kasi yung ribs natin sa baba, ang pinoprotect niyan is the liver on the right area and of course spleen on your left area. So pag may mga pag may mga fractures sa part na yan, dapat na-assess din yung mga organs na naka-align on those ribs. So, what are the signs and symptoms? Yan, for the rib fracture, merong severe pain. Okay. Another is a point tenderness, yan, muscle spasm. And around the fracture may be a bruise. Yan. On this part, makakakita ka ng bruises. Yung purplish skin discoloration. On the external fracture naman, dito, nagkakaroon siya ng anterior chest pain. Siyempre, yung sternum natin, nandito sa harap, there will be an overlying tenderness on the affected part. Your ecchymosis is caused by bleeding, okay, underneath the skin. So, kung makikita mo yung mga red spots na yan, those are ecchymosis. Also, meron siyang crepitus. Ibig sabihin, these are sounds, no? Grating sound, grating, produced by fractured parts of the bone. Okay? Those are crepitus. Usually, yung crepitus na yan, ma-feel mo during palpation. And the potential of a chest wall deformity. Yung deformity nito, and kung makikita mo, nagkaroon siya ng depression sa may sternum. Ang tawag mo dun ay pectus excavatum. Yan, pectus excavatum. Now, for the management of sternal and rib fracture, we need to have this pain control. Diba yung sa signs and symptoms niya, meron siyang chest pain. Ayan. Okay, surgical fixation is rarely necessary. Bakit? Because ribs may heal on their own. But of course, it depends on the severity of the fracture. Kasi kung kailangan naman talaga ng surgical operation, magka-undergo si patient ng surgical operation. Okay. If it is mild, okay, and does not require surgery, you need to instruct the client to do self-splint with the hands and arms or a pillow, especially when the client coughs. Okay. Pag nag-cough si client, kailangan niyang mag-self-splint. I-support niya yung affected part ng kanyang hands or arms or di kaya ng pillow para hindi mag-move yung fractured ribs. Okay? Kung ano naman, kung hindi na kaya ng self-splint, we nurses or the doctors may do the splinting, okay, on the chest. Now, let's have this flail chest. Pag sinabi mong flail, meaning kasi nito, it's a wave or a swing. And bakit sinabing flail? Because of the paradoxical manner. Ano yung paradoxical manner na yan? As the chest expands, the detached part of the rib segment moves in a paradoxical manner. Yan. Di ba during inspiration, normally during inspiration, nag-expand dapat yung lungs. That's the normal. Pero in flail chest, ang nangyayari, nagde-deflate pa siya. Okay? Kasi napupunta yung hangin doon sa isa. So, yon. Yung during expiration naman, imbis na mag-deflate, nag-e-expand pa tuloy. Kasi yung pressure hindi na nakakontrol nung rib cage kasi disrupted na nga siya kasi na-deform na nga siya. So, hindi na niya nagagawa yung function. Kagaya dito, hindi na nito nagagawa yung function. Hindi niya na may maintain yung pressure inside the thoracic area. So, ang flail chest, it is usually occurs when 3 or more adjacent ribs are fractured. So, ibig sabihin, it is a multiple fracture, resulting in free floating rib segments. So, what are the management for a small segment of the chest? Yan, yung pag small segment of the chest ang affected, ang gagawin lang natin dito is to clear the airway. Paano? Through positioning. Ano yung mga positions niya? Fowler's position, semi-Fowler's. Depende kung saan magiging comfortable si patient. Nakakahinga ba siya ng mabuti? Or naglilid pa yun sa into this niya. Okay? So, dapat nakikita mo kung yung positioning mo ay okay kay patient. Yan, coughing. We need to instruct the client to do coughing and deep breathing para na sa ganun ma-expectorate kung ano mang fluid ang nag-accumulate on the airway. And also, suctioning. Pag hindi na kaya ng coughing and deep breathing, syempre mag-suctioning na tayo. We need to use equipments na to suction the secretions. And dahil may pain si client, we need to have your pain management using your intercostal nerve blocks, yan mga blocks, tapos your opioids. Those are pain relievers. With your mild to moderate flail chest injuries, ayan, we need to monitor fluid intake and appropriate fluid replacement. Kasi maaring sa flail chest kasi magkaroon ng massive hemorrhage. So, maglilid siya ngayon into your hypovolemia. So, kailangan nating mag-replace ng fluid. Also, we need to have this relieving chest pain. Yung mga, pain relievers. Yung mga blocks. Intercostal nerve blocks, mga ganun thoracic epidural blocks. Yung opioids natin. Closely monitoring for further respiratory compromise. Maaaring mag-lead kasi ito into your respiratory failure pag nag-worsen. So, dapat close monitor mga ganitong pasyente. And in severe cases, the patient may undergo endotracheal intubation and will be connected to your mechanical ventilation. Kasi, maring loss na yung function ng respiratory system. Hindi na siya magpa-function because of the injury na nangyayari. Another is surgery. This is to stabilize the flail segment. Pero, this is the last resort, yung surgery. Usually, yung mga chest trauma, ang last resort is surgeries. Okay? Patient-controlled analgesia, yan for pain management. Mga blocks natin, analgesia and opioids. Okay. Now, let's have this pulmonary contusion. Contusion means blood capillaries have been ruptured, resulting to bruises. Alam niyo yung mga capillaries, di ba? These are the end part of your blood vessels. Okay? So, kapag nag-rupture yun, lalabas yung mga blood, okay, na nandoon. Siyempre, puputok. So, pulmonary contusion is the damage to the lung tissues resulting in hemorrhage and localized edema. So, on that part na nagkaroon ng contusion, magkakaroon ng edema. So, this is the pathophysiology of the pulmonary contusion. Una, yan, chest injury. Tapos, magkakaroon ng abnormal accumulation of fluid in the interstitial and intra-alveolar spaces. So, sa mga space between the cells, lung tissues, and sa spaces between the alveoli. magkakaroon na ng fluid doon. Leading now, okay, to the leakage of your serum protein and plasma. It is thought that injury to the lung parenchyma and its capillary network results in a leakage of serum protein and plasma. And this leaking may exert on osmotic pressure. Ano ba kasi ang osmosis? This is a movement, okay, of solvent, okay, to it's a movement of solvent that will pass through a semi-permeable membrane. So, ang mangyayari, because of that protein, ipupul niya lahat ng fluid outside, enhances loss of fluid from the capillaries. Lalabas lahat ng fluid on the capillaries, and it will enter. Ano yung mga fluid doon? Blood, mga cellular debris, mga ganun. And then, pupunta ngayon siya sa lungs and will accumulate. Mag-stay siya sa bronchioles and alveolar spaces. Pag nag-stay siya sa bronchioles, ano mangyayari? Magna-narrowed ang airway ni client. Okay, leading to your dyspnea. Okay, and of course, maaaring magkaroon ng air trapping because of the accumulated fluid. Also, magkakaroon ng accumulation on the alveolar space. Dito naman, magkakaroon ng hypoventilation. Hindi na masyadong makakapag-ventilate si alveoli dahil nga napupuno na siya ng fluid. And that will cause the magi-interfere yan ng gas exchange. So, wala nang masyadong gas exchange na nangyayari. Wala nang ventilation and perfusion. And now, the patient may experience hypoxemia and carbon dioxide retention. Because of the narrowed airway, hindi na makakapag-exhale si patient ng mabuti, kaya nagkakaroon ng carbon dioxide retention. So, yun yung pathophysiology ng pulmonary contusion. So, what are the signs and symptoms? Sabi ko nga kanina, mayroong accumulation on the airway. So, nagiging narrow, kaya nagkaroon ng dyspnea. Okay, because of hypoxemia, si patient ay magiging restless. Okay, increased bronchial secretions. Yun, because of the accumulation of the fluid. Hypoxemia dahil wala ng ventilation na nangyayari. Hemoptysis, because some of the blood will accumulate into the bronchioles. Decreased breath sound because of the decreased airflow rates. Crackles and wheezes. Crackles because of the accumulation of fluid, and wheezes because of the narrowed airway. So those are the signs and symptoms of your contusion. Assessment and diagnostic findings. Pulse oximetry, nakita naman natin kanina, merong hypoxemia. Your ABG, okay, your arterial blood gas analysis or measurements will reveal respiratory acidosis. Okay? And your chest x-ray may show pulmonary infiltration. Ibig sabihin, there's an accumulation of fluids in the lungs. So, what will be your medical management? Your medical management here is oxygenation since may hypoxemia. And of course, we need your pain management. Kasi syempre, may trauma na nangyari. Okay, mayroong disruption dun or may damage sa mga tissues, kaya may pain. Adequate hydration because of hypovolemia. Kailangan yan. Volume expansion techniques. Ito may kasama to, volume expansion techniques, your postural drainage, physiotherapy, including your cuffing, and endotracheal suctioning. Itong mga to is used to remove secretions. Bakit kailangan i-remove yung secretion? Para ma-clear yung airway ni client. antimicrobial therapy, this is used to combat yung contamination on the affected part. Bronchoscopy, pag hindi na kaya ng mga volume expansion, postural drainage, ganon, kailangan na natin gumamit ng equipment with your bronchoscope to remove secretions. Pag hindi na kaya talaga ng client na huminga with her own, maaari siyang ma-intubate and will be connected to mechanical ventilation. And because of the edema, di ba dun sa pulmonary contusion natin, magkakaroon siya ng localized edema. So to reduce that, magbibigay si doctor ng diuretics. And sometimes, pag mababa yung contusion, meron ding effect nito on the gastrointestinal area. So, maaaring magkaroon ng gastrointestinal distension. Okay? Kailangan ng nasogastric tube na on that case. Now, let's have this penetrating trauma brought about by your gunshot and stab wounds. Penetrating chest trauma means it occurs when a foreign object penetrates the chest wall. So, dito meron na siyang opening. Iyon yung pagkakaiba ng blunt tsaka ng penetrating chest trauma. May opening na ang penetrating. So, ito. Yan, that's the chest. Okay, yung isa, punctured lang ang chest wall. Yung isa naman, up to the lungs. Hanggang doon na yung affectation. So, under your penetrating is your pneumothorax. Pneumothorax. It occurs when the parietal or visceral pleura is breached. So, sabi ko nga kanina, ito, hanggang dun na sa lungs. And the pleural space is exposed to positive atmospheric pressure. So, meron na, mag-enter na ngayon yung air inside the pleural space because of the opening. Okay? We have two types of your pneumothorax, your simple and traumatic. Your simple pneumothorax and your traumatic pneumothorax. Sa simple pneumothorax, it occurs as air enters the pleural space through the rupture of a bleb or a bronchopleural fistula. Merong opening, okay, na maliit. And then, this may cause a partial or complete accumulation of air in the pleural space but does not result in major changes in the patient's physiology. Kaya siya tinawag na simple pneumothorax. It does not result in major changes in patient physiology. Not unlike with your traumatic pneumothorax that will have a major result. Occurs when air escapes from a laceration in the lungs. So from this one, pag nagkaroon yan ng laceration, lalabas lahat ng hangin dito, tapos papasok siya on the pleural space. Another is, it enters the pleural space through a wound in the chest wall. So, pag nagkaroon naman ng opening dito, papasok ngayon yung air. So, mapupuno na ngayon ng air yung pleural space mo. So that's your traumatic pneumothorax. So, what are the signs and symptoms of pneumothorax? Absent breath sounds on affected side. Bakit merong absent breath sound? It is because of the decrease ng flow sa affected side. Kasi nag-collapse na yung lungs because of the pressure. Yung mga hangin nandun na sa may pleural space. So, wala nang airflow na nangyayari sa affected lung. Cyanosis because wala nang ventilation na nangyayari. Decreased chest expansion unilaterally. Well, wala nang mag-expand dun kasi. Kung makikita natin, yan, yung lungs dito, hindi na makakapag-expand because of the pressure here. Tsaka wala na dyang negative pressure. Ang meron na dyan, positive pressure. Okay? So, dito na lang ang may expansion. Another is dyspnea. Of course, magkakaroon ng lung collapse, magkakaroon ngayon ng difficulty of breathing. Hypotension, this one, a positive pressure kasi on the pneumothorax will change the dynamics of your intrathoracic process. Ngayon, ang mangyayari dyan, magdi-decrease ngayon yung return ng blood. Okay, magdi-decrease ang return ng blood, leading to your low cardiac output. Kasi di ba yung sa blood pressure, ang formula known is cardiac output times systemic vascular resistance. So, kapag nag-decrease ang cardiac output, eventually, magdi-decrease talaga ang blood pressure ni client, and that is your hypotension. Yan. And because of the damaged tissues, magkakaroon ng pain, and we have this emphysema on the subcutaneous area. Emphysema means it is an air that is abnormally present within the tissue. So, yan. Sa mga subcutaneous areas, pupunta sila doon, and it is being assessed during palpation. Pag pinalpate mo yung lungs, mafe-feel mo merong crack, grating sound. Ganun. Okay, and to compensate the situation, si patient ay magkakaroon ng tachycardia and tachypnea. And with your tracheal deviation, because of the tension, okay, on the pneumothorax, because of the pressure here, yan, hindi lang yung lungs yung affected, pati yung mediastinum. Since sabi ko kanina, naka-aligned yung mediastinum into the trachea, paano mo malalaman na merong mediastinal shift? In the hospital, pag meron ng tracheal deviation, yung trachea, maiiba ng location. So, di ba dapat nasa central siya? Okay, nakita nyo naman sa anatomy kanina, nasa center yung trachea. Kapag nagkaroon ng mediastinal shift, sasama ngayon yung trachea, magde-deviate. Mapupunta siya sa unaffected side kasi doon walang pressure. Okay? So, that's what you call mediastinal shift. What is the management? So, ang management nito is CTT. So, it depends kung dun sa severity at saka kung anong meron doon sa pleural space. Yan, a small chest tube, which is French 28, is inserted near the second intercostal space. Pag yan ay hangin lang. Okay? Pag hangin or tubig, fluid lang. Pero, pag yan ay hemothorax, pag blood na yung nag-accumulate on the pleural space, ang gagamitin ay French 32 or greater. Kasi mas, diba, sabi nga nila, mas malapot, diba, yung blood than the fluid, than the water. Okay? And it is usually inserted in the 4th or 5th, yan, 4th and 5th intercostal space. And using antibiotics, sabi ko nga kanina, to combat decontamination on the lungs. What are the nursing management? Apply a nonporous dressing for the open chest wound. Nonporous, ano ulit yung nonporous? Impermeable, hindi nakakapag-pass through ang fluid. Now, let's have this administration of oxygen as prescribed because of hypoxemia. And place the client in a Fowler's position, but you need to assess whether the client is comfortable in that position. Pero this is advisable, Fowler's position for chest expansion. Okay? Prepare for chest tube placement, which will remain in place until the lung has expanded fully. So, you need to prepare those. Monitor the chest tube drainage system. Diba tinuruan na kayo kung paano mag-monitor? Ano yung makikita nyo? Ano yung normally na makikita? And ano yung mga abnormal na nakikita? And monitor for subcutaneous emphysema. Diba yung air that is present within the subcutaneous parts. So